Hello, everybody. My name is Dr. Sarah Wooten. I am a small animal veterinarian, and I am here with cats.com on this live stream to answer your questions about your cat. Health questions, some behavioral questions, right? I am a general practitioner, but I can give you everything that I know. And it's important to know that everything I'm sharing with you guys today from my information and my education is for entertainment and educational purposes only, not designed to replace the care and relationship that you have with your local veterinarian. Okay, so I'm going to be talking to you guys and answering your questions as if you were my friend or my family member or what I would do with my own cat. So I already see, welcome to people who are showing up. I already see some fantastic questions showing up. So I will definitely address those. I had one come in before the stream started. And I don't have a name with this question, so I apologize. But this viewer has a 5-year-old cat. So if you're on today and you ask this question, just pop into the chat and say hi. But they said, hi, Sarah and Mallory. My 5-year-old cat has some medical issues. She had urinary crystals about 2 years ago, and the vet prescribed Hill's urinary prescription diet. She has been on it ever since. I've not noticed any more signs of those issues. And every time they go to the vet, she doesn't have any crystals. A few weeks ago, she was having stomach pain, blood in her stool. We took her to the vet. They did an ultrasound and said she had an inflamed GI tract, and they recommended a GI prescription diet. My question is, I do not personally love the idea of prescription diets. The ingredients from everything I've read and heard don't seem good for my cat. Heard a lot of mixed advice about being on these short-term versus long-term. My vet always says to stay on them. Do you have any advice? Sure. So we're hanging out at a dinner party right now, right? And you're like, hey, I have some questions. I know you're not my vet, but what do you think about this? So here are my thoughts. I have done this. I have had patients who have had urinary crystals or urinary problems, and I put them on the diet. And usually it's something like the Hills diet that she was talking about. I also use Royal Canin SO a lot. And my conversations with owners went something like this. This food is medicine. You need to think about it like medicine because it is changing your cat's urinary pH and making their urine more dilute, so they're less likely to have crystals, they're less likely to have stones, they're less likely to have infections. So, of course, an owner, right, would say, well, do I really have to continue this food forever? Why would I need to do that, right? And here's the thought processes of the people in the white coats. If we have you feed this food forever, then you will likely never have any urinary problems again, right? Because some cats just don't, their urine pH is a little bit off, and they're stone formers. They're what we call stone formers. So I generally say, you're welcome to go off of this food and try something different. If you do want to stop using this food, my recommendations is to have a urinalysis, which is where they check the urine for crystals, 1 month after changing to the new food that you want to feed, and then 3 months, and then 6 months. And the reason why I would do it 3 times is because you need to see how your cat's body is responding over time. Also, it needs to be a fresh urine sample. It can't be something that you collected at home and then just brought in the next day, because as urine sits, any type of urine, it will start to form crystals. And so what we see under the microscope gets messed up if it isn't a fresh sample. So that's one option you can try. And actually, since you're on a GI diet right now for your cat anyways, it could be a perfect time to try this experiment, right? And again, I'm just talking to you as a friend or what I would do with my cat, right? So the veterinarian also recommended a GI prescription diet to you, again, because that's how we're trained, right? We learn a lot about these diets in vet school. We know that they're for medicine. Are they naturally the best diet on the planet for your cat? I don't know, right? I don't know your cat. I do know that these foods have very specific reasons why they are fed. So if you don't want to feed your cat a GI inflammation diet, if you were seeing me and you were like, I don't want to do that, I would say, okay, no problem. Why don't you try some boiled chicken and rice? And then if you want to go back on the urinary diet, great. Once your cat is feeling better, go back on that. If you don't want to do the urinary diet anymore, you want to try an experiment and see if another food will cause the problems again, you are in the driver's seat of your cat's health. You can choose to do that. But again, I would recheck urine if it was me 1 month after starting the new food, 3 months and 6 months, and they'd be fresh samples. And if your cat doesn't form any more crystals, you're probably in the clear. I'd still get a urinary urinalysis once a year on that cat. And again, that's my own thoughts. Okay, everybody, hello. Look at all these questions. Oh my gosh. What is stomatitis? From Yared G in cats. Marianne also asked, can you discuss feline stomatitis? My cat underwent antibiotic, steroid, and dental extractions. Do you have any at-home treatment regimens, suggestions for maintenance? Thank you. Sorry your cat went through that. That's got to be so frustrating. Stomatitis is severe inflammation of the gum tissue and in the back of the throat of a cat. So it can cause gums to bleed. It can cause severe inflammation and redness of the gums. It's very painful. It causes cats to be miserable and they stop eating. What causes it? Again, we're not entirely sure. It could have a genetic component. It's probably more than one thing. Genetic component. Some Asian breeds are more predisposed to stomatitis than others. Could be a nutritional component. Could be a viral component. Most of these cats are exposed to a whole host of viruses when they're little. And sometimes with a cat's specific immune system, it can cause some inflammation. And that inflammation usually shows up in the mouth. What causes it and home maintenance. So I would say your best bet, unfortunately, is still whole mouth extractions, because what happens to these cats is they start to have an allergic reaction, an autoimmune reaction to their own teeth. Weird, I know. And so as long as those teeth are in there, they continue to have all this inflammation. Can you manage it with steroids and antibiotics, like Marianne said? Sometimes. But most of the time, these cats end up having all their teeth removed, and then their symptoms completely go away, and then they do well. Sometimes you have to feed them canned food for the rest of their life because they don't have any teeth. Oftentimes, these cats, even without teeth, can still eat dry food. It's crazy. I don't know how they do it. They do it. So your best maintenance, really, you shouldn't have hardly any maintenance once the teeth are gone, because the cause of the inflammation is gone. So as far as at-home treatment, sometimes these cats can benefit from a lysine supplement. Lysine is it's an immune supplement for these kids. These kids can also do really well with a high-quality fish oil supplement. Fish oil has omega-3 fatty acids in it, DHA and EPA, and they are wonderful. They're wonderful cat supplement, also dog. And that can help promote oral health and reduce inflammation. Also good for their kidneys as well. Okay, but you shouldn't need to do hardly anything else. If your cat is still having flare-ups, you got to go back to the drawing board. You got to go see your vet. You got to see if there's something else going on there. Okay, so that is it on that particular question. Hopefully, Mallory, I see her backstage there. Hopefully she can bring up a new question for me. Oh, here we go. Marianne, you got more stuff. 1 TDC oral health supplement, propolis oral throat spray, pure coconut oil. Coconut oil doesn't seem to go over very well in cat systems. It causes a lot of GI stuff, I've noticed. To avoid frequent steroid usage, absolutely. You don't want to keep giving these cats steroids, and you want to avoid harsh meds like cyclosporine and Atopica. Oh, Okay, so your cat responded well to the extractions, but just received an injectable steroid for a flare. Oh, and then Helene Tilkulski has an. Okay, so cats.com has put up a resource for you, Marianne, under the comment section, and they have a nice resource on stomatitis. I definitely understand the desire to avoid steroid usage and antibiotics and Atopica and cyclosporine in your cats. So I get that. One TDC oral health supplement. One TDC. Give me a second while I look into it for you. Okay. I am going to have to, what I'm going to do for you on this one, Marianne, is I am going to do a little bit of research onto it, and then I'm going to send that information off to my moderator, and she will get it to you. Hopefully we can do that. I'm not sure if we can do that, but I will do my best. And if your cat needs a steroid injection like once a year for a flare-up, that's not bad. That's not going to impact their health over the long period of time. Again, for educational and entertainment purposes only, but in my 16 years of practice, a cat that needed an injection once a year because their stomatitis was acting up didn't really do anything bad. I would look into fish oil, definitely. The other thing you could do again, we're back to the therapeutic diet situation again, is you could talk to your veterinarian about a hypoallergenic diet, because sometimes they are reacting to ingredients in their food. Also make sure that everything has been removed from that mouth. Make sure there's no lingering infections in that mouth. I should probably switch to a new ooh, mysterious backstage, Mallory. You guys are great. And you're welcome, Marianne, for answering your questions. So I saw another question up here that I want to address. Why is my cat ripping off my wallpaper? Your cat needs to scratch, my love. Carzy G, your cat needs to scratch. That's a natural behavior. Make sure they have vertical scratching and horizontal scratching. Okay, so I'm going to go back up. Helene, I saw your questions about the SO. First, a quick question. Do the cranberry supplements work for that? No. Cats do not metabolize cranberry the same way humans do. And they don't like it, generally speaking. It's not going to help you at all. Making sure that cat is drinking a lot of water, because what happens with the crystals is they tend to form when the pH is off, right? If it's either too acidic or too basic, and then if the urine is concentrated, right? Because if you think back to chemistry, solutions, the solutes in a solution, once it gets to a certain level, they tend to precipitate out. How many people remember their high school chemistry classes, right? Same thing in a cat's urinary bladder. When the concentration of solutes gets to a certain level, boom, you get crystals, then they aggregate and cause stones. So, and I apologize because I am scrolling backwards through. Okay. So going back to Yared on your cat with stomatitis, if your cat has not had whole mouth extractions of the teeth, unfortunately, that's the next step. So if you go talk to a veterinarian, that's likely what they will tell you, just so you know. And I want to make sure that I'm getting these questions. Okay, Helene. Hello, my friend. Tukulski. Hopefully I'm saying that right. Has questions about the urine and the SO again. The Royal Canin SO. Holy cow. Okay. Oh my gosh, you guys have so many good questions. Okay. So, Helene, I'm going to try and answer this as fast as I can. Hates the SO canned food, refuses it to eat it. She will eat the dry food. I give her regular wet and SO dry. If that's all you can do, hun, then do that. As long as your cat is not having any kind of symptoms right now, I would say, if you were my friend, which you are, that I would just check the urine every 6 months, have it checked by a veterinarian. Urinalysis should not be that expensive. And if you are being proactive, I would say your analysis could cost you $45 US is maybe where it's at right now. Also, to save on exam fees, because if you're taking your cat in every 6 months, just ask, hey, can I drop my cat off? Can you collect some urine? And then I'll pick them up later. You can call me with the results. That way you don't have to go in and pay the exam fee as well. Hopefully I'm not going to get in trouble for that one. But I'm trying to give you guys the best information that I have. Okay. Abigail Rose. I have 2 female cats. One is 2, one is 1.5. They don't like each other. I'm tired of living in my bedroom. Please help. Oh, honey, I'm so sorry. Okay, so some cats don't get along. Cats, like humans, can be introvert, extrovert, ambivert. Some cats don't like other cats, and they form a personal group with themselves, and maybe you guys, and even if the other cat lives there, they're still not happy. So what can you do? Well, my love, it depends a little bit upon your square footage. If you have a lot of square footage, you could just keep the cats in different parts of the house at all times. Sounds like that might not be a thing. The other thing you can do is separate the cats entirely, and maybe cats.com has a good resource on this, on reintroducing the cats to each other over a period of weeks, going really, really slow. And this is things like letting them smell each other through a door, letting them see each other but not be around, feeding them within proximity of each other but with a barrier in between, letting them smell and see each other but pair it with something that they really like a treat or food. And you may need to do this for quite some time. Okay, hopefully there is a resource that we can share about this. Hopefully Mallory, mysterious backstage Mallory, is getting that for us. In the meantime, you can also talk to your veterinarian about medication that will reduce anxiety. Are there over-the-counter things? For sure, there's so many over-the-counter things that you can do to lower the level of stress between these two animals. Think of them as tools that will help you as you're doing the desensitization, okay? And then you're just going to need to think about this in a period of weeks, maybe months, 6 to 8 weeks. And then they may never be good friends. That's the other thing. You just have to understand that. So make sure each cat has their own set of resources that are just theirs, right? So you want to have, each cat needs to have their own resting place, litter box, toys, scratching posts, all their own stuff. And if you have 2 cats, you're going to need 3 litter boxes, and I would put them in separate places if you can. And that will reduce competition between the cats, because you have to think when these cats are fighting, they're stressed. They are not having a good time. You're not having a good time. They're not having a good time. And stressed cats are more likely to manifest behavioral and health disorders. Ain't nobody got time for that. So if you do all of this and it's still not working, you've got your tools, you're doing your training, you're going real slow, you're taking care of yourself through it as well, and you're still not getting anywhere, you may need to look at rehoming one of these cats. Because at the end of the day, cats that are fighting all the time and not happy, they're not happy, you're not happy. So we sometimes have to make tough decisions to help these animals be happy. Well, Abigail, the other thing, I see that you're leaving more comments in the comment section. So stay with the barriers. If they're playing with each other, that's great. Make sure they have all their own resources. Also utilize, again, I talk about this every single time, guys. Feline pheromone spray, Feel Away, comes in a spray, diffuser, wipes. Hopefully it doesn't dry. Most cats, it makes them happy, okay? But you're going to have to just go really slow. The other thing you could do, you can hire a cat behaviorist to come to your house and observe the behaviors and give you a specific treatment plan that will walk you through. That is available as well. Does it cost money? Yes, it does. Does it work? If you follow the instructions, it works a lot of the time. Okay. Interact safely. Lynn Kelly has some good recommendations about how to help cats interact with each other. Queen Noonies is saying nice things to me. Thank you. Love your videos. I love you too. Thank you. I'm going to go. I see you guys are helping each other out in the comment section. Quick question, can you downgrade from a water fountain to a water bowl without problems? The answer is sometimes. Some cats don't care. Other cats will start going and peeing on your laundry if you change anything, right? So what I would recommend doing if you want to do that, just set the water bowl, out kind of close to the water fountain and leave them both out for a while, maybe a month, right? And then take the water fountain away and see how your cat does and make sure that they're still drinking, that the water level's going down in that bowl. So sorry, I wish I could give you a specific answer on that. Okay, I have, yes, and so Abigail, honestly, the question about the introducing two cats that are fighting, I can't answer it in a short period of time. Like if you were going to talk to behaviors about this, you would go in for an 1.5-hour consult at the very least. So I love that the people in the comment section are throwing up additional resources out there. Jackson Galaxy, definitely, he's got some great behavioral videos on this that you can utilize. It's in Go. It's in okay, I'm getting some direction from the mysterious backstage Mallory that I am going to answer a question from a viewer named Chum. Hello, friend. Love your name. Hey, Dr. Wooten. Oh, hold on. Okay, sorry. I'm having some. Okay. All right. Hey, Dr. Wooten, my male cat sometimes has uneven pupils. His left pupil is smaller than the right, but it becomes very noticeable when he's looking outside, and the slit is almost not even there. Well, how old is your cat? And is your cat having any other issues? And is this something that's happening all of the time? Some of the time? Has it been happening for a while? Do you notice any other changes in your cat's behavior or in your cat's ability to jump and navigate things? So basically, there in your eye, you have the brown part that is your iris that opens and closes the black part in the center, which is the pupil, right? And in us, it is circle. In cats, it's the line, but it's the same exact machinery. And basically that iris functions to let a certain amount of light in or not. And if it's very dark or if the animal's very scared, it gets really big. If it's very light outside, it gets very narrow. There's certain drugs that it can actually cause differences in those pupil sizes as well. When you have pupils that are two different sizes, that is called anisocoria. That's your word for the day, my friends. Anisocoria. And basically, one of the pupils is one size and the other one is another size. So there are certain things in the eye that can cause that to happen. There are certain things in the brain and in the cranial nerves that can cause that to happen because your eyes are very close to your brain and they are in some ways an extension of your brain. Sometimes this can show you that there's a significant issue in the neurocircuitry, like your nerves in your brain and everything that are going to your eye. Other times it can just be that muscle, if in very old cats, can get worn out a little. Other times certain drugs can cause that. Head trauma can cause that as well if it's something that's acute. So if it's something new that you've noticed and your cat is otherwise acting okay, with no other issues going on whatsoever, you have two options. You can wait and monitor it at home. Remember, I'm talking to you like a friend. Or you can take them into a veterinarian to get an ophthalmology and a neurology exam. And so basically what they'll do is they'll check all the nerves, they'll check the brain, they'll check the spinal cord, all with an exam, actually. And then ophthalmology, they will shine a light in there and they will see, is this actually closing and opening? What's going on? I definitely don't want to scare you. A lot of times it's no big deal. Other times it can be just that little tiny thing that's like a little off where you go in and you get it checked, and it could be a big deal if you left it, but you went and got it checked and it's not such a big deal. So definitely talk to your local veterinarian. Sometimes it's not a big deal. Sometimes it's just the cat. Sometimes it's something they got into. Sometimes it's head trauma. Sometimes it's There's a lot of things it could be. If you're worried at all, talk to your local vet. Get an eye exam, get a brain exam. Hopefully that answers your question. Okay, he turns 3 in December. It's been happening for 6 months. 6 months. Strange. Well, it could just be your cat. But if he just turns 3, does he go in for his annual exams? Because if he's going in for his annual exams and it's already been going on 6 months, I mean, if it was my cat, I'd probably just wait till the next exam and then say, hey, doc, check this out. What's going on with that? And they'll probably say some of the same things that I'm saying. So you can either wait and see, you can take them in, but remember, you're in the driver's seat. I've seen it where it's no big deal whatsoever. It's just a variation in the cat. And I've also seen it where different sized pupils in cats that were actually acting sick, showed us the first sign of a brain tumor. Don't want to scare you. Just showing you the range of what it could be. Okay. I have like 4 minutes. Richard, 20-year-old cat, Richard Jaretsky. My 20-year-old cat has been peeing while sleeping in her bed. What could be causing this? 20. That's an old cat. So, okay. Couple of things. Could be, I'm going to point to 3 big things that, could be going on. Could be age-related decline in the ability to, could be some old age incontinence, basically is what I'm trying to say. So in older animals and in older people, the little muscle that keeps the bladder closed just gets a little worn out. So it could be that. Number 2, in an older cat, you always want to make sure that there's no kidney issues going on or hyperthyroidism going on or any other hormonal disorders. So make sure that they've had a clean urine and blood work in the past 6 months at least. Number 3 could be a primary problem with I'm going to give you 4. 3 could be urinary tract infection. Again, checking a urine sample will let you know. 4 could be some age-related cognitive decline. So your best bet to do that is just make sure that your cat's otherwise healthy. Get their urine checked and their blood checked. Make sure to ask your doctor to do an SDMA test on them as well. SDMA, it's the test for early detection of kidney disease. I would also, when you have the labs done, I would also, if it was my cat, run a thyroid on that cat. If everything checks out normal, talk to your veterinarian about incontinence. Because obviously that's not hygienic for you. Nobody wants that. And it can cause urine scald if cats are wet continually from urine. They don't tend to wear diapers quite as well, but there are other options out there. So just make sure that cat is healthy and there's not something like a disease process that's going on versus age-related incontinence. Okay, I got 2 minutes left. Here's another pinned one. Hey, so my cat, hello, my friend. I like your name. Hey, so my cat Rigby lost 2 of his tiny, I think that's tiny, front teeth, and he's 3 to 5. Should I be concerned? He doesn't seem to be in pain or anything. I don't know. Okay, so the little teeth in the front, they have 4 of them, top and bottom. These are called our incisors. And in the wild, these cats will use them to prehend prey. They don't really use them a lot in domestic. Why do they fall out? I don't know. Trauma, infection, sometimes genetics. Again, stomatitis can cause it too. Lots of things going on there. But if the teeth are out and the cat is eating normally, drinking normally, happy, not having any problems urinating or defecating, gums look nice and pink, they're not red and bleeding or anything, you're probably fine. It's probably just cosmetic. Thank you for asking. Okay. He looks like Mike Tyson now. Well, that's character. That's a story. Now you have a story. That's great. Okay, my friends, I am so sorry. I would love to sit here for 2 hours and answer your insightful questions because it sounds like you are an amazing bunch of people that have been curated here together by our mysterious backstage Mallory. And I appreciate your questions. I will be back on Wednesday to answer more. So your best bet is to jump in early, ask the questions early, and then our mysterious backstage Mallory. Hopefully she'll be front stage with us again. Thank you, Chum. I'm so excited that you actually want to spend time with me and talk about animal health related things. I appreciate all of you guys so much. Stay safe, and I will see you